I had a back injury. It started 2 years ago where I first injured my back on the job. I'm an EMS worker, so I do a lot of lifting. And a year ago, I re-injured my back, and I got a herniated disc, pinched nerve, and I'm unable, you know, like my back just keeps having muscle spasm. I feel like I'm limping a lot. It hurts a lot. It hurts to sleep. Having difficulty time sleeping at night.
Gotcha. All right, so.
See my last hope.
All right, you got it. Let's take care of this, all right?
Okay, great.
See here, there's a lot of swelling right here. Okay, it's a whole entire full broad band right across. Okay, even more so on the right side. Okay, the sacroiliac joint right over here. Okay, more so over here. Feel that? There's a nice little bump over here.
That's why it probably feels like my leg wants to give out sometimes. Like
Exactly.
I feel like I can't walk. Like there's times that I feel like my legs are just gonna.
But that's a deal over here. Okay, there's a lot of swelling all around this region over here. So now we're gonna motion palpate this thing. Okay, so you see over here. Okay, it doesn't move. Your sacrum doesn't move at all. That's a brick wall. So you have to move your hip forward and backward without a problem. And the right side also forward and backward without a problem. But see this sacrum over here? It just won't move to the right or to the left. Okay, there's just no give. There's nothing over here. So even try to lift it forward, nothing. Okay, but we checked all the other structures of the spine. There's a little give, but it's very stiff. Okay.
That hurts. All of that. There.
2, 4, 12, 11. 10 right there too, right? This is number 11.
Yeah.
All right, so with the structural analysis, okay, here's the deal with your spine over here. This triangle-shaped structure over here, that's the sacrum, okay? We consider this the foundation for the entire spine. Why? Because you see, all the structure of the spine and everything from the waist upwards rests on that one bone alone, okay? So because on you, this one is compromised, that's why you see all the significant rotation going on over here, okay? So, but more importantly, this is what tells us right over here, okay? This spot region right over here, this one over here, between the fifth lumbar and the sacrum, is supposed to have a slight little angle in that spot right there. But no, completely parallel. Okay. So in the Gonstead work, what we call this is considered a base posterior sacrum, meaning the whole entire sacrum itself knocked backwards. Right? So as a result, and that's what's causing all that instability from that level all the way straight upwards. That's the one we need to correct on you. That's it. Okay. Now, in terms of the other problem you've also been experiencing at nighttime, okay, it's coming from here. Because all this is being twisted up, when we correct this, okay, I would not be surprised, it takes the biomechanical strain off of this fellow over here, release the nerves, okay, and allowing that organ to work a lot better. It's going to give you the relief you're looking for at the nighttime, okay? With your spine itself over here, because the sacrum over here, it went backwards okay, and rotated towards the right. So since it rotated this way, that's what all the structures following this way as well. Now here's the thing as well, okay? Your body, okay, we have two gyroscopes, our eyesight, the eye riding reflex, okay, and the cerebellum. That's what keeps our head level as much as possible. So how can we keep this head level on top of this, on this foundation? Well, you have to compensate. And the way you compensate on you was kept on turning right, roller from here. And that's what you see over here. Kept on going this way, and then it kind of rotated at the very top over here. That's to help explain what you see. Right, this way, kept on going this way, keep on going all the way, and then it started to rotate a little bit towards that way. Right? So that's why the answer is right there at that foundation. That's the only thing we really need to correct to resolve all of this issue.
And the rest will correct itself eventually.
You got it.
I know, but we really gotta open
It
this
hurts.
thing up. I know, but you gotta relax the shoulder. That's how we make the magic happen. Okay, you gotta relax the shoulder
Oh
even
my
more.
god.
Okay, I know. If you want, you can even say Dios mío. Okay? Just relax this over here.
I feel relief. I feel some relief.
Okay, so clue me in. What's different?
I don't know, something over here just feel like a release because this felt tight, this right side. So
What else?
I don't feel like it's restricting my movement as much.
Good.
So that's good.
Machi, how is that right foot right now? The pressure on the right
It
foot?
feels better. I had a lot of like, it was like I had numbness on my heel before. Like my foot felt heavy.
Okay. And how's it now? Do you start to feel sensation there now?
Yeah,
Good.
you do.
All right.
Definitely. It's
How do you
great.
like that?
That's great.
Okay.
Shoulders are squared again.
Feels much better.
Yeah, as your husband mentioned, shoulders look more squared off, right?
Yeah.
Okay.
Now you have to readjust to walking normally.
Almost like I'm learning to walk again without my cane.
That's something, huh? So, close in. How's it so far?
I feel a lot of relief. I'm able to walk again without the cane.
Good.
I don't know, now I'm like so happy and hopeful. I'm gonna get much better. 2 years of, pain and just cramping and feeling like I was like no alternative, like, no
I hear you.
answers. So, it's like a miracle worker.
Thank you. Thank you.
It really is. So,
Right. So we're all set.
All right, great. Thank you.
You're welcome.
I recommend.
Thank you.